আমি মোহাম্মদ সজল ইসলাম বাংলাদেশ থেকে অ্যাস্টার হসপিটালে চিকিৎসার জন্য এসেছি। ওখানে অনেক গুরুতর অসুস্থ হয়ে গিয়েছিলাম। তো এখানে আসার পরে ডক্টর রাজীব লোচান এবং ডক্টর দ্বারকানাথ আমার ফুসফুস ও লিভারের কিছু জটিল অপারেশন করেছে। আপাতত আমি অনেক সুস্থ আছি। আফটার অপারেশন আমি হাসপাতালে অনেক ভালো সেবা পেয়েছি। আমি আমার আশার থেকে অনেক বেটার সেবা এখানে পেয়েছি।
Hi, my name is Kazi Anwarul Rafique. I am from Bangladesh. I am Sajol's uncle basically. Regarding the Aster Hospital, I came to know from my closest friend, and he contacted with this hospital, the international patient service patient team. They all over there took care of us from Bangladesh. They arranged our visas and the arrangement in the airport service and everything from here. And regarding Sajol, I have to say that I am very much thankful to the hospital, even the international team, especially the Shagodada, Radhikadi, and I'm really grateful to the doctors as well. They have done for a lot for us, because it was a 16.5 hours operation, and it was a huge operation, so far I learned. And one thing I must say that Dr. Rajiv Lochan and Dr. Dwarakanath, they have a huge workout before this operation, and they have totally understand us that what are they going to do with the patient before they took him to the OT, and even after the OT. The ICU service was excellent. I was there for several times to visit my patient, and what I see there, the nurses and the other doctors, duty doctors, are always there, and they are always taking care of my patient, and they give whatever they want. Even the next morning, the operation, the physiotherapy team, they work hard about Sajol, and they make him stand by 1 or 2 days. And I'm really happy of that. After completing the Sajol's operation, I have to leave hospital and had to take a guest house, and that also arranged by Aster Hospitals, the marketing team, because that Dada and Didi, they also take care of it, and we are very happy with that. Yeah, it is important to be mentioned that during this pandemic time, the hygiene and the other things that is supposed to be more careful, and Aster already take care of us. We basically completed our COVID test from Bangladesh after the visa when we started for India. Then whenever we entered into the hospital, first that thing they did with us, they primarily took our test for COVID-19, and then they admitted us in the hospital. And another thing, I am very pleased with the Aster Hospital. From the airport, Bangalore airport to hospital, we didn't had any headache how we will go there and what is the way. Basically, we have the first time in Bangalore here, so Aster totally take care of us. And the food quality, yeah, it was nice, and even as an attendant, I never had to think about more of my food and my accommodation. Aster already took care of it, and really thankful to Aster RV Hospital. They have arranged a beautiful arrangement for us. Thank you.
Hello, my name is Dr. Rajiv Lochan. I am the lead liver transplant and HPB surgeon here at Aster RV Hospital. This young chap, Sajol, came to see us with regard to his liver problem. I mean, I was really impressed when I saw his CT scan and listened to his story, which his uncle had told us over phone before he came down from Dhaka. So as a young boy, he was diagnosed to have inherited cyst of the liver, and this unfortunately had ruptured when he was at a football game many years ago. And in Dhaka, he had been treated very eminently, very nicely. He'd had the right side of the liver removed at a major operation many years ago. And this is a good treatment for this type of problems with inherited disease. Inherited cyst disease is a infection of the liver. It can also spread to the lung and sometimes to other parts of the body. It is very common in our tropical countries, Africa, Central Asia also. and we have seen numerous such patients here in our practice. However, what made the problem very unusual and difficult for Sajol was that after his operation about 10 years ago, he now began developing a complication of this hydatid cyst. The cyst had recurred, means it had come back in size, it had grown to a very, very large size inside the abdomen, and it had actually penetrated through the respiratory muscle, which we call the diaphragm, which is between the lung and the liver, and had gone into the lung. And that is how a few months ago he began coughing up some fluid, along with that some hydatid cyst particles as well. And he was obviously extremely distressed by it, and having thought that the problem had been resolved once and for all, for the problem to now come back up again, and this was obviously of great concern. And he had various tests done in Bangladesh, at which they had diagnosed the extent of the problem. And I must say that the scanning and the investigations done in Dhaka were very good. They were of very good quality. Unfortunately, the operation which was needed for this problem could not be resolved over there, because this needed a combined operation of a liver team and also a thoracic surgical team. So this is the problem that Sajol was faced with, and he was prepared for the operation by giving some medicines. There is a medicine which is called albendazole, which is available very commonly, and we use it for treatment of hydatid cyst. He had been started on that for many weeks, and through his friends and contacts, they reached out to us here, and once we saw his scans, we discussed it in our team with Dr. Arvind, who is sitting with me, our HPV liver transplant surgeon, and numerous other colleagues, including our expert infection diseases consultant, our radiologist, and also we planned his operation with our anesthetists and also with the thoracic surgeons. All these expertise is available under one roof here, and that is why multidisciplinary care, that is multiple different specialist doctors, working under one roof, are needed to solve complicated problems like the one Sajol had. So the plan for his operation was a combined operation where the remaining right side of the cyst, right side of the liver where the cyst was, and the right lower part of the lung needed to be removed. This was a technically extremely challenging operation because it was stuck to various important blood vessels and arteries and bile duct, and also had involved into the lung. My colleague Dr. Arvind will talk about the intricacies of the operation and how we planned it.
Hi, I am Dr. Arvind Kirambi Sheshadri, consultant HPV surgery and liver transplantation at RV Aster Hospital, Bangalore. So as Dr. Rajiv had mentioned, Sajol presented with a very interesting and difficult problem. So he had presented with a recurrent hydatid cyst in the right lobe of the liver, which had invaded the diaphragm and had gotten into the lower lobe of the right lung. So he was admitted a few days prior to the surgery. He was given albendazole prophylaxis, which he was taking for some time. In his pre-op evaluation, we did a complete cardiopulmonary evaluation, and the echo and TMT was fine. The pulmonologist had a look at him. He did a 6-minute walk test, and he was found to have good exercise capacity. And with consultation of our thoracic team and the anesthetist, we planned the surgery. The initial plan of the surgery was to be performed by the thoracic team. So they used a technique called a single lung ventilation, following which the thoracic team went in, did their part of the surgery. They removed the lower lobe of the right lung. This took around 4 to 5 hours, following which the integrated liver care team headed by Dr. Rajiv started the abdominal part of the surgery. So there were a few difficult parts in this surgery. One, it was a recurrent hydatid cyst. It was a redo surgery. The hydatid cyst was stuck to the main vessels of the abdomen, the portal vein, and it was extending toward the left portal vein. It was also stuck to the inferior vena cava. So the challenge was to get the cyst out safely, minimizing blood loss and avoiding major issues in terms of bile leak. So the surgery went on as planned. it took around 6 to 7 hours to complete the surgery. Initially, we resected the cyst along with the remaining part of the right lobe, taking care to preserve the inflow vessels to the left liver, taking care not to injure any major bile duct structures in the left side of the liver. Once we were able to remove the cyst along with the part of the liver, then we proceeded to resect the part of the diaphragm which was involved. The diaphragm was repaired primarily, and following the completion of surgery, he was extubated and shifted to the ICU in a very stable condition on minimal inotropic support. His post-op course was as expected. After a period of 2 days stay in the ICU, he was shifted to the ward, and following which his recovery was satisfactory and discharged on post-op day 12 with a small drain in the abdomen.
I think on behalf of everybody in the treating team here, I'd like to say that we're really happy to see Sajol Islam going back home fit and healthy. He's lost some weight, but that's not surprising because he's had a really big operation, removing quite 1/3 of the right side of the lung, and also having a redo liver operation where the right lobe was removed. This was possible because of the efforts of lot of different specialists working together, and this is what we pride ourselves here at Aster RV on. He's had quite extensive preoperative workup, including dynamic exercise testing, 6-minute walk test, planning the operation with the thoracic surgeons and the anesthetist. And after nearly a month now, totally, since he came here, he is able to go back home. And all this was accomplished during the COVID pandemic as well. They have faced a lot of challenges coming from Bangladesh to Bangalore here. Although we are well connected to, during normal times, they've had to make a land journey to Calcutta and then come down here, and they're actually going back by the same route. At the end of the day, what is most important is that all these efforts have paid off, and and I do hope that Sajol will continue to do well, and wish him all the very best.